Here, and I just wanted to talk to you today about depression and how you can work on kicking it in the face, because it is an ugly, ugly thing that I have never enjoyed experiencing, but I want you to know that you are not alone. Started to feel for the past year and a half is I really started to just feel down, and my energy and my emotions would just really started to tank for me. And I really wasn't sure what was going on until recently, when I just knew that I wasn't feeling normal. And so it was upon my husband's suggestion that perhaps it was my birth control that was causing me to feel depressed and to feel down. I said, okay, maybe it is my birth control. And I looked up the birth control I was taking, and I saw some of the side effects, and some of the side effects did say that depression and anxiety were things that could be affecting me. And so when then I decided to go make an appointment with a doctor. He was actually a new doctor that I hadn't usually seen. I told him that I was feeling really down. I just felt really low. I didn't feel normal. I even told him that I had thoughts of having suicidal thoughts. And you really have to be open and tell him when you go into your doctor of the thoughts and the things that you're experiencing. Because if you're not open and actually tell him about what is going on with you, then you really can't get down to the root of what's happening. And so to backtrack a little bit, a year ago, in September, I decided to start life coaching. And I think I just figured, you know what, I'm going to do this life coaching. It's going to help me. And honestly, it has helped me, and I did it for 1 year. And the life coaching was with Jody Moore. And it was really a great experience, and I really loved it. But I just knew that as much as I was trying to fix my thoughts, I really needed to fix my hormones and anything else that was going on. And so upon my doctor's request, we decided to go ahead and get some blood work done. And we tested my vitamin D levels, my vitamin B12, my testosterone, and then also this other genetic. It's called MTFR. I'll have to post it and link it. I wanted to get down to the root of this. I'm just kind of the type of person that I don't just want to be like, well, I guess I'm depressed and I'm just going to deal with it. No, I really want to figure out what's wrong with me. Like, is there something wrong with my levels? And I don't just want to pop pills just to pop pills. Like, I really want to figure it out and just knock it out of here. You know what I mean? Just solve it, not just, take this pill and you'll have it figured out. No, like, let's he actually asked me if I wanted to take an B12 injection, and I said, sure, let's do it. When I went in, I really went in with like, whatever it takes, let's get it done. And as much as I hate getting my blood drawn and all of that, I agreed to it. And so it took 3 weeks. It was kind of like the longest 3 weeks, because I kept on checking them with the nurse, and she said, your results aren't in yet, or when they do come in, you will see the doctor, and then he will discuss the results with you. I really didn't experience anything different as far as the B12 shots were concerned. And when I went in back at my 3-week follow-up, he did ask me that. He said, did you experience anything different with the B12 shots? And I said, no, not really. I mean, I drink Zip Fizz every day pretty much, and that helps me get through my day. And he said, you would definitely have felt something. And I said, then I guess I didn't. So he pulled up my labs and my levels, and he said, wow, like all of my levels, my testosterone, my B12, my vitamin D, all of those levels were just low. They were really low. And so then that's when he recommended the pellet therapy. And again, I am just to the point where I'm like, okay, if this is going to help me, then let's go ahead and do it. I am not a doctor. I am not at all one that can like say this is what you have. I'm just sharing my experience, and perhaps it will enlighten you and give you perhaps more information for you and figure out as to why you're feeling the way you're feeling. So I said, okay, let's do the pellet therapy. Let's get it done. Basically, that would help with my levels as far as feeling low. And he also said that I tested positive for this genetic mutation, which I don't know. I'm kind of wondering if I've had it all my life. You know, all the vitamins that I am taking and the minerals and the foods I'm eating, my body does not methylize it properly. So that just means that I am not getting all the benefits in like other people are. So you would think like, oh, I'm taking these vitamin D pills, or I'm taking these vitamin B12 pills. And you're wondering like, why isn't this helping me? Well, this is why, because your body doesn't convert it as like other people do. So that completely made sense to me. I said, okay, let's take the vitamins we need. We scheduled an appointment for the next day for me to come in and get the pellet therapy. Therapy it's a tiny little grain that is inserted in your body, and it's like the size of a rice. I didn't see exactly how they inserted it into me, but I'll just share my experience with you. So they place it basically like on your bum. So they will ask you to lower your pants, and they inject lidocaine inside of you. And I guess that's probably like the worst pain. I mean, just take a deep breath and just say, ready, go. And so, you know, breathe in, breathe out. They shoot you with the lidocaine. And then after they shoot you, then they go ahead and they cut your skin a little, and they insert the pellet, and then they stitch you back up. So after they inserted the pellet, what I did notice was that it was tender. I did take some medicine beforehand. I took Tylenol, and because a friend of mine had told me to take Tylenol beforehand. So I would definitely recommend taking Tylenol beforehand. They recommend that you don't get the area wet at all. So you shouldn't be exercising or using your lower hamstrings or glutes. Now, I didn't really listen to that advice. I didn't get it wet, but I did exercise the next day. It is sore. So if you want to wear compressed leggings or, you know, tights when you're working out, that is really helpful. I want to say that it really affects people differently. I mean, a few days later, I was running. You know, I did a run around just some quick sprints as part of my workout. So I am going back in a few weeks to test my levels to see how I am feeling. But he did say that you will start noticing differences within 2 weeks, and that is going to be happening here shortly. I am approaching the 2 weeks. The vitamins that I have been taking take 4 weeks to go into effect. And so I really am starting to feel better. I kind of feel like a fog has been lifted. And honestly, when you are down and you are depressed, I just want you to know that there is a way to have your problem solved. Like, don't ever think that there's never a way out of it.